Hi everyone. Now we can see MCQ of community health. The first question: oldest communicable disease control measure is. Oldest communicable disease control measure is quarantine, isolation, health education. The answer is isolation. Isolation is the oldest communicable disease control measure. Then second question: cornerstone for the control of communicable diseases. Cornerstone for control of communicable diseases: health education, rapid identification, treatment. Answer is rapid identification is the cornerstone for control of communicable disease. Then next question: the most neurological complication associated with swine flu influenza vaccine. The most common neurological complication associated with swine flu influenza vaccine. Increased intracranial pressure, Guillain-Barre syndrome, epilepsy. The answer is Guillain-Barre syndrome. Then next question: method which is used to carry small quantities 16 to 20 vial of vaccine. Method which is used to carry small quantities, that is 16 to 20 vials of vaccines. Vaccine carrier, ILR, refrigerator. The answer is vaccine carrier. The full form of ILR, ice line refrigerator. The answer is vaccine carrier. The next question: the most common method of storage of vaccine of at PHC level. The most common method of storage of vaccine at PHC level, primary health center level. Refrigerator, ice-line refrigerator, cold chain. The answer is ILR. Then sixth question: a system which is used to help the storage and transportation of vaccine at low temperature is. A system which is used to help the storage and transportation of vaccine at low level is cold box, cold chain, refrigerator. The answer is cold chain. The next question: recommended temperature of storage of polio vaccine is. Recommended temperature of storage of polio vaccine is 30 degrees Celsius, 20 degrees Celsius, 4 degrees Celsius. 36 degrees Celsius, 36 degrees Celsius, minus 20 degrees Celsius, minus 4 degrees Celsius. The answer is minus 20 degrees Celsius is the recommended temperature to store polio vaccine. The next question: passive immunization is achieved by. Passive immunization is achieved by vaccines, antisera or antitoxins by birth itself. The answer is antisera or antitoxin. Next, immunoglobulins are administered to intravenous, intramuscular, hypodermal. The answer is intramuscular. Then half-life of Ig immunoglobulin E is. Half-life of IgE is or immunoglobulin E is 120 days, 2 to 3 days, 6 to 8 days. The answer is 2 to 3 days. Then half-life of immunoglobulin A 1 to 4 days, 6 to 8 days, 10 to 15 days. The answer is 6 to 8 days. The next question: major immunoglobulin of serum. Major immunoglobulin of serum. IgA, immunoglobulin G, immunoglobulin F. IgG. Killed vaccines are administered by. Killed vaccines are administered by IV or IM, subcutaneously or intramuscularly, hypodermal. The answer is subcutaneously or intramuscular. Then next question: immunobiological substance which produce specific protection against a disease. Immunobiological substance which produces specific protection against a disease. Immunity, vaccine, immunoglobulin. The answer is vaccine. Vaccine is immunobiological substance which produces specific protection against a disease. The next question: humoral immunity is associated with the T cell, B cell, alpha cell. The answer is B cell. Then the time interval between the invasion of agent and the appearance of first sign of disease. The time interval between the invasion of agent and the appearance of first sign of disease called transmission period, incubation period, termination period or termination phase. The answer is incubation phase or period. Then carrier of a virulent carrier of a virulent organisms are called? Carrier of a virulent organisms called monocarrier, pseudocarrier, agent. The answer is pseudocarrier. Then a person who carry disease producing organism without producing any symptoms is called. Person who carry disease producing organism without producing any symptoms is called host carrier agent. Carrier. Hospital acquired infection is termed as. Hospital acquired infection is termed as contagious, nosocomial, none of this. The answer is nosocomial. Then next, infection transmitted to animals to man is. Infection transmitted to animals to man is mycosis, zoonosis, anthropology. The answer is zoonosis. The next question, an outbreak of disease in a bird population is. An outbreak of disease in a bird population is. Ornithology, abornitic, oncology. The answer is abornitic. Then an outbreak of disease is termed as. An outbreak of disease is termed as incidence, epidemic, prevalence. The answer is epidemic. Then next question, unusual occurrence of disease in a particular region. Unusual occurrence of disease in a particular region, pandemic, epidemic, incidence. The answer is pandemic. Then the first phase of epidemiological investigation is. First phase of an epidemiological investigation is analytical study, descriptive studies, cohort study. The answer is descriptive studies. Then next question, relationship between the prevalence and incidence can be expressed as. Relationship between the prevalence and incidence can be expressed as. I is equal to P by D, P is equal to I into D, D is equal to PI. I stands on incidence, P stands on prevalence, and D stands on duration. And the answer is B. Thank you all.